Welcome to this video about medical needs and the intersection with SEND. Some factors to consider. Some medical conditions may cause the pupil to be away from school due to being unwell, require time from the classroom, for example, to take medication, to go to the toilet more frequently, or to be away from an activity that would be detrimental to their health or safety. Makes it difficult to participate in some physical activities. May make it more difficult to concentrate on tasks, reduce physical stamina and energy levels, affect the pupil's sleep, cause self-esteem and mood issues such as feelings of irritability and restlessness, and it may lead to behavioural changes and differences. Potential barriers to learning that could impede the pupil's progress, which are not necessarily a SEN, but do require reasonable adjustments and plans of support. For some pupils, managing the physical aspects of their condition may lead to some barriers to learning that could impede their progress. This could include one or more of the following issues. Attendance in lessons as well as any interventions may be disrupted. Participation in some activities within lessons may be reduced. Completing tasks may be more difficult. And social aspects of learning alongside their peers may be more challenging. SEN linked with medical needs. Sometimes a pupil's medical needs might cause or intersect with other short-term or longer-term SEN. This potentially includes cognition and learning needs, speech, language and communication needs, and social, emotional and mental health needs. Cognition and learning, usually specific learning difficulties. Does the pupil's medical condition cause ongoing difficulties with their information processing speed, memory, including working memory and short-term memory, motor skills, which may, for example, affect their coordination and handwriting, or their reading and writing skills? Communication and interaction, speech, language and communication. Does the pupil's medical condition cause ongoing difficulties with their speaking, including verbal fluency, word finding, attention and listening skills, understanding of language, or their pragmatic and social use of language? Social, emotional and mental health. Does the pupil's medical condition cause ongoing and significant difficulties with anxiety, low mood or depression, or self-regulation of difficult feelings, such as anger, leading to behaviours that challenge? Medical needs and SEND. Good practice. It is beneficial for the school's medical conditions policy to provide coverage of possible SEN and how these needs are identified and supported. Aligned with this, it is helpful for the SEND or inclusion policy and statutory SEND information report to reference health needs in some way. Ensure that the SENCO and SEND team have at least live access to the list of pupils with health needs, so that this can be monitored for updates and viewed for key information, which may prompt further work if SEN needs to be considered. As part of a routine identification of SEN systems within the school, make judicious use of school-based evidence, checklists and screeners to identify signs of SEN, plus carefully consider the evidence provided in professionals' reports. In some cases, it may also be appropriate to coordinate onward referrals to assessing professionals. And information provided on individual healthcare plans should be in some way integrated or linked with SEN documents that outline adaptive teaching strategies, reasonable adjustments, and any necessary interventions, typically pupil profiles and provision maps for pupils who are also on the SEND register. This is the end of this video. You can view more videos on this channel in the bite-sized series, including other bite-sized SENCO videos.